Hello everyone, and welcome to this audio podcast. This audio podcast is part of the analysis edition. This is an audio podcast as part of a Bostic Summit and part of a manuscript Cyclone. This is an audio podcast, part of the analysis edition and part of another Storm Robotics production. This is in this audio podcast will be an overview as part of the synopses in this as part of a synopsis in this series, and in the series and here you, here those who listeners or viewers are checking out the audio podcast series under Storm Robotics Productions can see a sort of a list of sort of topics that will be a list of sort of subject focuses and topics that will be sort of highlighted in this series, and all of these works have been sort of peer reviewed and published, but this audio podcast series provides particular or specific updates in as part of the work as part of these works. So as part of the synopsis, the following is part of this overview. So the provision of educational support can improve patient care, but there has also been disparities between patients who are self-motivated to navigate elements of healthcare and those who seek out understanding yet have little desire to becoming self-empowered. Education is identified as an essential tool to use wherein patients become more autonomous surrounding health and disease. Education initiatives help people with long-term conditions, for example, or LTCs, develop skills and confidence to navigate intricate systems. Retrospectively, CKD or chronic kidney disease healthcare education provision has been in the hands of healthcare service providers, including nephrologists and specialist nurses. CKD patients are not always aware of diagnoses or armed with concepts linked to CKD, owing to how it can become quickly multifaceted. However, education is important because CKD is irreversible, and patients need to be aware, should be aware of disease, and so thus education provision also should be timely, accurate, and centric accordingly. So CKD is divided into 5 stages based on estimated glomerular filtration rate, or EGFR, according to guidelines such as the Kidney Disease Outcomes Quality Initiative, or KDOQI classification. A minimum of 2 EGFR values at least 3 months apart should be or can be used to diagnose and classify CKD. Temporary rises or increases in creatinine are common, and the diagnosis of CKD should only be based on a sustained decline in renal function. Patients with an EGFR, estimated glomerular filtration rate, of 60 ml per min or over should not be considered for CKD unless there is other evidence of renal damage. In context of primary care, CKD is a major has been evidenced and documented as a major a major public health problem that affects that can that has affected over 25 million adults in the United States, and in the United Kingdom, approximately 5 to 6% of the population have CKD stages 3 to 5, with a high prevalence in older people. Older people are more socially deprived communities. It is estimated that around 50% of females over 75 years and 50% of males over 85 years have CKD stage 3 through 5. As such, although controversy exists as to whether it is a normal as such, although controversy exists as to whether it is a normal a sort of normal aging process for patients with CKD stage 3A, it is recommended that age alone should not preclude patients being managed according to National Institute for Health and Clinical Excellence, or NICE guidelines. The risk of developing CKD has retrospectively been a documented risk through increasing with age. And in context of around secondary care, patients with CKD or CKD patients have a significant risk of progressing to end-stage renal disease and requiring a form of renal replacement therapy. Unfortunately, as patients progress, uh, patients experience an increased risk of death from about 20% for CKD stage 3 um, to to the from 20% in around CKD stage 3, and higher percentages in around CKD stages 4 and 5, when equated to patients with estimated glomerular filtration rate of more than 60 ml per min, which may include CKD stages 1 and 2. The impact of CKD care in the secondary healthcare sector is accompanied by a substantial responsibility in around CKD and the role of point of care education, or POCE. Healthcare education has advanced and diversified for CKD patients over the past 2 decades. Before 2000, there was an instinct for education to be provided to adult and pediatric patients. Much of the delivery of education for CKD patients has been prompted as part of a health service delivery, and in the main it would be provided by specialist nurses or physicians, thus meeting patient information and educational needs. However, owing to more information having transpired from physical to online spaces, patients are now either signposted or prompted to using the internet to meet information requirements, and patients also use the internet to access peer support groups through social media. And whilst that can be helpful, especially wherein patients have opportunity to share experiences, peer support alone does not override the necessity for educational support. The learning style, health and digital literacy of patients also varies. It is in this context patients are more informed, or misinformation arises and impacts negatively on patient experiences, compromises quality of care, and overall down spiral diagnoses and disease trajectory. So in around this, as part of this audio podcast series and part of works, the aims as part of this series was to critique number one to critique and to provide an autobiographical context for a portfolio of research outputs. Two, to provide chronological description tracing the development of the portfolio of research outputs. And three, to provide an evaluative description and originality of each of these each output. Number four, to provide an evaluative review of the contribution made by the portfolio of research outputs to subject or discipline area. Number five, to provide a critical reflection and six, to provide an understanding of collaborative research on outputs where applicable, and seven, highlight to provide an overview in around conclusions and in around these works and in around some aspects around prospective research. The objectives at the same time um, is is that this audio podcast seeks to provide a critique of publication outputs aligned to nephrology and kidney care, and thus seeks to also highlight a reflection of how research outputs have been assembled and put into practice, aligned to understanding the role of online consultations and point of care education, or POCE, for nephrology patients through online support groups. In this works there is there is a basis in where the role of point of care education, or POCE, and online consultation for nephrology patients through online support groups will be sort of contextualized, highlighting reflections surrounding listed in those works listed as in those works listed in listed as part of this audio podcast series. And at the same time, there'll be some works that have been where there's been a sense of collaboration through presenting works, sort of works from 2020, sort of more recently in 2023, and sort of retrospectively in around 2017. So this audio podcast will look at a sort of an overview perspective in around the INHED conference 2023, how young people cope with CKD 2012, the Lord Mayor of Bristol's blood and organ donation campaign in around 2014-2015, coping in young people with CKD 2015-2016, service evaluation for young people in CKD 2018, healthcare scientists and CKD educational support 2020, education empowerment and practice excellence and practice review 2021, and also in around the history of medicine, and the works, as sort of an overview in the life of 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 a physician known as Ibn Zur, from the years 1094 to 1162, highlighting a bibliography in around some of Ibn Zur's works, from a time where Ibn Zur had been involved in works around some early sort of nephrology and urology practices, sort of retrospectively. So that draws this synopsis to a close. This has been a synopsis as part of analysis edition, part of a Bostic Summit, part of analysis edition aligned to a manuscript Cyclone, analysis edition, part of a Storm Bostics production, and once again, as part of this synopsis overview, there will be some descriptive information on social media as well. So listeners can check out the check out sort of similar related works through social media as well. So thank you for tuning in. This has been another Storm of Bostics production, and and hopefully will be intriguing for listeners out there. Thank you.